The morning show.
Yeah.
The Big Show with Glenn and Angel on Kiss 92.
Good morning.
Sometimes getting out of bed in the morning is a lot to deal with all at once.
Good morning, Singapore, and it's everyone's favorite segment. It's Good Morning Doctor, and today we welcome to the Kiss 92 studio gynecologist from Mount Elizabeth Hospital, Dr. Ma Lee. Good morning.
Good morning, Glenn and Angel. Good morning, everyone. I'm very glad to be here.
Thank you very much for taking time off and being here today.
We're glad to have you here, and obviously your title says it all. You're a gynecologist, so we're going to be talking about women's health. So what are the common conditions when it comes to women's health? What should we be looking out for?
Common conditions in women's health, they actually can range a lot because the most common one, of course, chronic pelvic pain, endometriosis, adenomyosis, fibroid, bleeding problems, etc. and all these things. It's very common, but the problem is that not many people actually know about this condition. Yeah.
Okay. And what is the difference between endometriosis and adenomyosis?
So in women's reproductive organ, if we can have a look at that picture, we can see that, okay, reproductive organ including uterus, fallopian tubes, and ovaries, etc., right? So adenomyosis means endometriosis inside the womb, whereas endometriosis means that endometriosis outside of the womb. So they are sister condition. It's just the difference between the position of the disease.
Okay, so for Glenn's sake, because he has no clue about
Yes.
any of this, asking for him, what exactly are these conditions? What is endometriosis?
Yeah.
What happens?
So normally when girls are having period, what happens is that the lining of the womb will shed out, come together with the period. And when period finish, the lining of the womb will grow again until the next period comes. So that is the inner lining of the womb, so the cells there. So for endometriosis, what happens is that the cells that are supposed to be in the lining of the womb started to grow elsewhere. So
Elsewhere meaning outside of the womb.
outside the lining of the womb. So if it grows outside of the womb, then it's called endometriosis. If it grows in the muscle of the uterus, well, that means outside the lining of the womb, it's called adenomyosis. So it can be anywhere, any part of the body, surprisingly. So we do have cases where the endometriosis can go to the lungs,
Oh, wow.
can go to the nose, can go to the ear, can go to the eye. Basically, this is a condition that can affect the whole body. So the only organ that hasn't been have endometriosis is the spleen. So all the other part of the body, you can imagine, do have case report of endometriosis. Of course, the most common one are still in the pelvis, but actually it can go to anywhere. in the body.
Wow, I didn't realize the nose and the heart, the lungs, you
Yes.
said. Wow, okay.
Yeah, I feel stressed out just listening to you guys talk about that condition, you know. Let's continue to talk to Dr. Ma Lee on The Big Show TV. Meantime, here's Doja Cat with Agora Hills on Kiss 92.
So when it comes to endometriosis and adenomyosis, this happens for women or girls that still have their periods. So it's a certain age group. I mean, like people, women who have already menopause, are not at risk of endometriosis.
Actually, it's not.
Okay.
So endometriosis do mostly affect women in reproductive age, but it does still affect women after menopause as well. Because again, for a lot of type of endometriosis, of course, after menopausal, without hormone stimulation, they tend to be quiet. But some can still produce, some types of endometriosis are able to produce their own hormones still. So in rare cases, can still be active and can still cause pain and problems as well. The other issue is after menopausal, certain types of endometriosis do have a small risk of turning into cancer.
Oh.
So that's why even after menopausal, we still need to monitor regularly and make sure that things doesn't change.
Okay, okay. So speaking of monitoring, like how often should we go for checks? I know pre-menopause, it's like a yearly check, your pap smears and whatnot. What about like throughout your life? Can you just like kind of take us through the age groups of how often women need to go for checkups?
Right. So before menopausal, that really depends on the symptoms because for endometriosis and adenomyosis, mostly they present very differently at different part of the reproductive age. For example, if the patient is trying to conceive but have endometriosis that cause the infertility, and at the same time she's having pain, the treatment will be different compared to a girl who has completed family. The main priority of the treatment will be for pain management. Then the frequency of the visit might be very different.
Right, okay.
But again, for postmenopausal, if no pain, everything goes quiet, usually we do recommend yearly checkup. Yeah,
A yearly checkup, okay.
But before menopausal, depends on the symptoms they have, then the frequency of checkup will be very, very different.
Does it matter if you're sexually active or not?
It doesn't matter.
It doesn't matter,
What
so, okay.
matters more is the symptoms of endometriosis, whether they have fertility problems, what kind of pain they have, and what types of endometriosis they have, and which part of the body organ are affected by endometriosis.
Wow, okay. So much to think about, my goodness.
know.
And you say we're easy, we have easy lives.
No, I never said that.
No, that's true. Okay, what was I going to say? What about treatments? Okay, no, not treatments. Let's say, how will I know something's wrong? I mean, will I feel it, or is this kind of like a silent condition?
Good question. We call it a silent cancer condition. So what happens is that you can imagine endometriosis basically can affect every part of the body organ. So it depends on where the endometriosis is located. The symptoms can be extremely different. For example, it can be, so the common ones, if it is the pelvis, if it is the ovaries. So for example, if there's a cyst in the ovary that is caused by endometriosis, but the cysts have no scarring around it, no adhesion, they may be completely quiet. But if the endometriosis starts to spread elsewhere, for example, if go to the bowel, go to the ureters, go to the structures around it, these are the ones that start to cause pain. Pain, we can also have different types of pain, depends on where it is. It could be nerve pain, it could be adhesion pain, it can be pain on passing motion, pain on sexual intercourse, or pain on ovulation, etc.
So there's so much to look out for.
And you don't really know.
No,
You don't
so
really
it could be like an
what it
aching
is.
pain, it could be a
Correct.
sharp pain.
Can we have a look at the diagram again?
Wow,
Yes.
okay. That's
Then-
crazy. Yeah, tell us what we're looking at, because
Yeah.
I mean,
Yeah.
to the layman, this is just, the inside of a body. But tell us what we are seeing.
Correct. So this is commonly what we see, and the laparoscopy means that if we're looking at our pelvis from top-down view.
Top
the
down,
front-
okay.
The top is the front. The bottom is the posterior. So the one on top is the bladder. Then the ball in the middle
Yeah.
is the uterus.
Okay.
Okay, you see that two tubular
Yes.
structures?
Yeah.
That is the fallopian tube. And the white structures there is the ovaries.
Okay, all right.
Behind is the rectum.
Okay,
You see that two small yellow tube bilaterally?
yes.
That is the ureter that connect kidney to bladder.
Okay.
Yeah. So there's also structure. There's a ligament behind the womb as well that travel from the cervix to the spine. That part is called uterosacral ligament. So this is what we use to explain to our patients what is the location of endometriosis. Yeah. So again, depends on where the endometriosis is located. It can be on the bowel. It can be in the ovary. It can be on the ligament that is connecting uterus to the spine. It's called uterosacral ligament. Or sometimes it can extend it laterally, affect the ureter, sometimes cause kidney damage as well. So when we're seeing patients talking about symptoms, that is all the symptoms that we have to go through. It's not purely, do you have a period pain?
Yeah.
That is far from enough, because we know all these endometriosis would cause different kind of pain. So when actually we are seeing patients, we do need to ask them what kind of pain they have, whether it's acute onset, chronic onset, whether it's more of a shooting pain, whether it's more of a cramping pain, whether the pain is more related to passing motion, whether the pain is more related to sexual intercourse, etc. Because all these detailed symptoms, they do give us a very good clue of potentially where the endometriosis could be.
Why does endometriosis even happen?
So,
Or endometriosis?
right. Very good question. We used to think that endometriosis happens when the menstrual blood flows back into the pelvis. So rather than come out, some of the menstrual
Comes
blood
back in, right? It's like a
flow
backflow.
from the tubes go to the pelvis. But this is proven has to be wrong, because this cannot explain why endometriosis present elsewhere?
Outside
How
of-
can it go to the lungs? How do they go to the upper abdomen,
Yeah.
etc. Right? So right now, with a lot of research going on, what we do believe that unfortunately endometriosis happens in the fetal stage. So we were still in mommy's womb during the fetal cell differentiation. Some of the cells has already started to implant there,
On the outside.
and yes,
All right.
because we all come out from one cell. But during the cell differentiation, for example, some endometrial cells has already started to implant or started to grow in all these organs. It's just before we have period, things are quiet. Because before period, we don't have we don't have female hormone to stimulate all this endometriosis to grow. So they tend to be quiet. We won't know. But once the young girl started to have period with cyclical hormone stimulation, this is a time when endometriosis start to grow. When it grow, endometrial cells tends to bleed. They cause microscopic bleeding around it. Then bleeding will cause fibrosis. So with time, with cyclical growing of the endometrial cells, with cyclical bleeding, cyclical fibrosis and scarring, this is when symptoms may start to happen.
Wow. Okay. Are some women more at risk than others?
There are certain genetic factors playing
Okay.
around it. So worldwide, we do see generally Asian, unfortunately, were more higher risk of having severe endometriosis compared
wow.
to other part of the world.
Wow,
So there's
okay.
a certain genetic factors as well.
Hereditary?
We do see family inheritance pattern, but it's not 100%. It's not like certain genetic condition. If mother have, sure, the daughter would have. So we do see a trend of family inheritance, but there's no certain genes that will explain which of the genes are responsible for
For it,
endometriosis.
right.
Yeah.
Okay. Wow.
But like spoke about at the very start, in terms of women's conditions, there's so many.
Yeah.
But endometriosis is definitely, right up there, isn't it? One of the
Right.
most common conditions.
Right. So it is about 10 to 15%.
oh, that's
yeah,
quite
it
high.
is very high.
Is there a way of lowering your risk?
I would always say that early recognition and early prevention is important because there's no ways to get rid of it early, but there are definitely ways to recognize early, and by intervening and diagnosing early, we can prevent it from getting worse and causing more problems.
Okay.
So, because we do see very severe end of endometriosis before where it can go to bowel, we need to do surgery to cut the bowel, or sometimes it go to the ureter, cause kidney damage, and in severe cases, both kidney loss. So these are the cases actually, if we can diagnose early, we can recognize it the moment when it start to cause organ damage and start to intervene in it. By this way, we can actually avoid a lot of tragedies causing kidney damage, bowel damage, etc.
Okay, so
Early detection. Let's talk about early detection
Yeah.
when we get back on air. Okay, stand by.
Go back, this is the moment, tonight is the night, we'll fight till it's over, so we put our hands up like the ceiling can't hold us, like the ceiling can't hold us. Go back, this is the moment, tonight is the night, we'll fight till it's over, so we put our hands up like the ceiling can't hold us, like the ceiling can't hold us.
Kiss 92 traffic.
On the KJE towards the PIE, right before the PIE Changi exit, look out for an accident taking up space in lane 4. On the TPE towards the PIE, a vehicle's broken down before the KPE exit. And on the KJE towards the BKE, a vehicle's broken down at the BKE Woodlands exit. Look out for those situations. Let us know if you spot anything else. 885550
Good morning and welcome back to Good Morning Doctor. And today we say good morning to Dr. Mali, gynecologist from Mount Elizabeth Hospital. I feel like I've not been asking you enough questions today.
I feel like you need to come from a man's perspective, and
Well, now I know endometriosis and I know adenomyosis. But I want to ask you, Dr. Mali.
Yeah.
I'm sure people are wondering, right? How early should they start going for checkups? Because naturally, if the condition is detected early,
Right.
it would be safer for the patient. So how early should they start going for checkups?
Yeah. So I think one of the problems for endometriosis and adenomyosis is that there is a lot of cultural myth about it, because it is not uncommon for a mother or grandmother to tell the kids, oh, you have a period pain is normal. And once you get married or once you have child, your pain will be gone. So unfortunately, this is one of the very common reasons why endometriosis diagnosis is delayed. Because a lot of girls are just trying to tolerate the pain without going to see doctors. And then by the time they come to see us, the pain is basically unbearable. So the information we want to let the society knows that it is not normal to have a period pain. Because, of course, when period comes, you might have a mild cramps, but when the cramps becomes a monthly regular cramps and the pain is not responding to painkillers, it is not normal.
So the pain that we experience every month is not meant to be there? I mean, we're not meant to take painkillers to get rid of that pain?
You're not supposed to take painkillers for period cramps. If the cramps is mild, not affecting your daily life, you can monitor and see. But if the cramps or period pain becomes so severe
Unbearable.
that you need to take painkillers, it is abnormal. So that, and also it is not only about period cramps. So when talking about pain again, there could be many other pains that that patient experience. So if you're experiencing more than period cramps, if you have pain on passing motion, if you have that kind of sharp pulling pain, or if you have pain during sex, this is abnormal. So you should go to see a doctor to get a proper examination, ultrasound scan, or imaging studies to see whether you have endometriosis.
Wow.
You know, because like growing up, I mean, I'd see girls in school like go to the sick room because they were like coupled over by,
Yeah.
you know,
We all have friends like that,
Like, you know,
right?
their period pain is unbearable or they take a day off. I mean, there's even medication on the shelves to get rid of menstrual pain, you know, like painkillers and stuff like that. But you're saying it is not normal.
It is not normal.
Wow.
If you have a period pain that you need to take day off from school or from work, it is abnormal.
Oh my goodness.
So what's normal then? Like,
Yeah, for a normal period, like what?
Yeah.
What kind of pain is
should,
okay?
should there be pain at all?
Some people do experience mild cramps. If it lasts for one day and the next day the pain is gone.
And every month it's okay because
It is,
your uterus sort of like
yes.
with the blood and it's
Correct.
pumping and stuff, right?
Correct. So if it's just last 1 or 2 days and then very mild, does not affect your quality of life, you can monitor and see how it goes. But gradually, if you see that the intensity of the pain is increasing or the duration of the pain is increasing, then you should get alerted and see.
Wow.
So
okay.
speaking of endometriosis and adenomyosis, what are some of the advancements in treatments today for those conditions?
So there has actually been a lot of things going on in regarding the diagnosis as well as treatment for endometriosis because worldwide it's a known problem. The delayed diagnosis and treatment is not only in Asia countries. So if you search elsewhere, every year March actually is World Endometriosis Awareness Month.
Oh, right.
So why do we dedicate a whole month to raise awareness of this condition? Because we know it is a big problem. It is so common, yet it's so underdiagnosed and untreated. And of course, from the medical field, there has actually been a lot of progress and changes in regarding of how we diagnose endometriosis. So when we go to the textbook, medical textbook, maybe 10 years ago, we can still see, the golden standard of diagnosing endometriosis is laparoscopy. So laparoscopy is a surgery. So can you imagine in older days, we have to put patient under knife to diagnose the condition? That's not acceptable, right? So right now, what we use or commonly use to diagnose endometriosis, of course, it is ultrasound scan. But even for ultrasound scan, there's a lot of progress in how we diagnose because when we diagnose endometriosis, when you see a gynecologist, if we suspect endometriosis, we cannot only scan uterus and ovaries, right? Because we know 80% of the endometriosis are outside of the reproductive organ. So right now, when we are examining or scanning for endometriosis, so the map, the picture that I use is commonly how we use to map endometriosis. Basically, a proper endometriosis mapping should include kidney, bladder, ureter, uterus, ovary, tubes, bowels behind. So actually all these we can see via a simple ultrasound scan. So it is not the machine itself. it is how we train ourselves.
It's where
to
you
be,
go.
Yeah, to be able to recognize the endometriosis in various locations, to have a complete mapping of the endometriosis before we decide what kind of treatment the patients need.
Okay.
In
all right.
regards of treatment as well, because for treatment of endometriosis, there is a few arms basically. You have a hormonal treatment. We have very good hormonal treatment that helps to treat endometriosis. We have the surgical arms because for certain types of endometriosis, unfortunately, when medication does not help, when fertility factors comes into mind, then we have to resort to surgery. Surgery, again, we do very aggressive surgeries, but usually the recovery is much faster now because of the keyhole surgery, because of robotic surgery. Usually, even with a very extensive endometriosis surgery involving bowel, involving ureter, usually the patient just need to stay in hospital for 2 to 3 days before they go home. So the recovery is much faster with robotic, with keyhole surgery.
Okay.
And also fertility treatment as well.
Okay,
Yeah.
let's continue to talk to Dr. Mali on The Big Show TV. It's 8:24.
Kiss 92 time check by Pooh.
So you were talking about pain. You already said it's not normal to have period pains that really like you take a day off work, you take a day off school and all that. But when it comes to endometriosis and adenomyosis, is there ever a time when there's no pain?
There is also silent endometriosis.
So like
as
how will
well.
you know to go to a doctor,
Unfortunately, when it comes for silent endometriosis, some of them do come when they started to have fertility problems. They may not have pain,
okay.
but when they get married, find out they cannot get pregnant. When they come to see us, actually 30 to 40% of the couple with fertility problems are due to endometriosis. So a fair amount of them do diagnose because they have fertility problems. There's another types which can go very silent. For example, if the endometriosis are in the urinary system, for example, they affect the ureters. Unfortunately, we find that tends to be very silent because ureter endometriosis, in which when they cause the kidney to be damaged, they may not have severe pain. They may have only very vague flank pain, in which they may think is the back pain.
Oh.
But when it comes to us, that few very severe cases that we have, which had bilateral kidney loss, they surprisingly don't have much pain.
Oh my goodness,
actually.
okay,
So that's
okay.
that's quite sad.
So would a regular checkup detect it?
So yes, a regular check helps to detect endometriosis, but for those patients without pain, they may not.
That's what I
come to
mean.
see the
Yeah, if you
doctors,
have no
right?
pain or
Yeah.
anything, you just go for your regular checkup. Will
Exactly.
your gynae spot it? That's the question,
So
without the
severe
pain.
ones usually we should be able to spot it.
Okay, okay.
Especially even the pelvis. But for endometriosis that is outside
Elsewhere.
the pelvis, we have to tell all the specialists. Actually, during our awareness, we do educate, we do discuss with family physician, discuss with our colleagues of how to diagnose endometriosis, because endometriosis can be anywhere.
Anywhere.
Right. Yeah.
Wow,
So
that's
do
scary.
keep endometriosis diagnosis in mind. Yeah.
Okay, okay.
Do we have questions from our
Not
Facebook?
at the moment.
fans?
Not at the moment, no. Yeah. So how young have you seen endometriosis in a patient? I mean,
The youngest.
I'm assuming that it only starts when girls start their period. It doesn't start before? Is that a good assumption?
Mostly, yes.
Yeah,
The
okay.
symptoms do start after
After the
periods
periods,
start. The
yeah.
youngest girl I had is 13 years old.
Oh, no.
Yeah,
Okay.
yeah.
All right.
Very bad period pain when the period comes. Yeah.
And that started off with the pain, and that's what you
Correct.
got you guys checking. I had no idea because in school and at work you hear of girls getting cramps and all
Yeah,
that. It's just,
exactly.
it's just a thing.
My girlfriend's also in school before.
Yeah.
It's like, they're all like, oh,
And
it's
you
almost
feel
like
nauseous,
it's
and,
it's paralyzing almost pain.
and
you
it
know?
shouldn't be.
It shouldn't be.
But it
paralyzing.
won't always lead to endometriosis, right? I mean,
Chronic pelvic pain, there could be many other reasons as well.
Okay.
So not only endometriosis.
Okay.
So it can be bladder problems, can be bowel problems, can be nerve problems, can be vascular problems, can be
Okay.
pelvic floor problems. But
Okay.
it's always good to see a doctor if you have pain.
pain like that
Yeah.
month after month.
Exactly.
Okay.
Exactly.
And then some people say during the period they cannot take cold things. Is that true or is that just a myth?
I think that's a myth.
Old
That's a
wives'
myth,
tale.
But there are certain types of endometriosis, especially if it is near bowel. Maybe if you take cold drinks, they will trigger some mostly bowel movement, then it will make the symptoms worse.
But it's not gonna. It's
Yeah,
not
you're
gonna be
not gonna
bad for
worry.
you. Yeah. There was also a myth about taking pineapple to make your period come quicker.
I don't see any reason.
That's what people would say, because they would say they
That
would.
sounds even more ridiculous.
No, I'm telling you, it's the thing. The girls knew. So that if you're going for a camp or if you're going on a holiday and your period's about to come, but you don't want it during the holiday and during the camp, you eat pineapple every day so that your period comes before that, so you don't have it on holiday.
What?
I'm telling you ask the girls, they know this.
So, doctor, that's a myth, huh?
That's a
100%
complete
it's a
myth.
myth,
We
right?
do have medications to bring forward or delay the period.
Yeah, you
But
do, you do.
Pineapple, I'm so sure about that.
Okay, what about things like lifestyle, things that you do, home remedies, anything that can help with endometriosis to keep it at bay or?
So in endometriosis, we do use a multidisciplinary team. So we do work very often with dietitian, with pelvic physiotherapists to help managing the pain. So why does it help? Because you can imagine when there's scarring in the pelvis or near bowel, when you take a certain food that is more pro-inflammation, it will create a lot of gas, create a lot of inflammation around the bowels. So if there is a lot of scarring around it, it tends to make the symptoms of pain worse. So when we work with dietitian, usually we do advise the patient to keep a food map, like to see specifically is there any food that triggers more pain. And then we will advise the patients to slowly delete that food from the diet list. So this is more for pain management. And when it comes to physio, which is also very important because endometriosis actually basically we're dealing with a lot of scarring, right? So medication, surgery, we can remove the scarring, but the problem is that new scarring will still comes back. So how to prevent the scarring related problems is usually we go by pelvic physiotherapists, where they use a physical massage to trigger, to continuously massage those pain generator to stretch out the scarring to help release the pain.
Interesting.
So that is helpful even for before surgery. Certain type of patients do not need surgery. They just have scar problems where we can use physio to try to see whether it helps. Or those post-surgery, we do work with physio very, very regularly to prevent the scar-related problems as well.
Okay.
Yeah.
Okay, we're going for a traffic update and then we'll come up one last time.
Yeah.
Kiss 92 traffic.
Okay, let's take a look at what's happening on the roads. On Temasek Boulevard towards Rocher Road, avoid the left lane of vehicles broken down. Also on the PIE towards the airport before Eng Neo Avenue, an accident has occurred, causing a backup all the way to Jalan Anak Bukit. That's quite a stretch. Avoid lane 1. Also on the KJE towards the PIE, another accident before PIE Changi's exit, this time causing congestion all the way to Chua Chu Kang Drive's exit. Avoid lanes 3 as well as 4. Let us know what's happening out there. 885550
Good morning, and it is Good Morning Doctor Day, and we've been speaking to Dr. Marley, gynecologist from Mount Elizabeth Hospital, about endometriosis as well as adenomyosis. Now, before we let you go, Dr. Marley, what is the one thing you wish for our Kiss 92 listeners to take away from today's session?
I think one of the important thing I want everyone to know is that it's not normal to have period pain. So whenever you have pain that is debilitating, do see a gynecologist, especially the gynecologist who specializes in endometriosis, to get a proper diagnosis and treatment plan. Yeah.
And what kind of, for husbands who are dealing with, this issue, how can they be more comforting towards their
Very
wives?
important question. So I think husband actually can play a very important role, especially when the girl is experiencing pain. Do give comfort, maybe offer support, mental support is actually psychological support is very, very important for these girls, because actually this is a condition that actually may potentially affect throughout
Fertility
their life.
as well, yeah.
Fertility. So have a support from the husband, from the society is very, very important.
We all have to be understanding.
Of course.
Thank you so much, Dr. Mali, for
You're
coming
very
in today.
You're very welcome.
It's been
Glenn
wonderful
and
speaking to
Angel.
you.
Thank you.
Have a
Thank
wonderful
you so
day.
much. Thank you.
All right. We've been speaking to Dr. Mali, gynecologist from Mount Elizabeth Hospital.
You've been listening to Less Pain, Faster Recovery on how modern surgeries are changing the game with our experts.